Okay, hello everyone. Thank you for joining. Just to introduce myself, my name is Natalie. I'm from Simulator, and I handle the Levant region. And we have the manufacturer, Craig. He's the VP of Intelligent Ultrasound. And we have Nicola. She's the head of marketing from Intelligent Ultrasound as well.
Cool.
Okay.
Well, thanks for the introduction. Hello, everybody. It's nice to see a lot of people attending and listening, which is great. Hopefully, we can make this a good session and give you some good insight into Heartworks, which we've got here. What I'd like to do first, just give you a quick, short PowerPoint presentation, just on who we are, what we do, an oversight of Heartworks before we actually go in, do a bit of hands-on. Show you the system virtually, obviously due to COVID, and obviously any questions, then please pipe up and we'll try and answer the questions as best we can. So let me just see if this technology will work. Something's very strange here. One second. Okay, can you see that presentation, guys?
Yes, okay. هو ايه الصح؟ مش عارفه ايه الصح. بصي انا بشوف انا زيك على فكره برضو.
Natalie, can you see that screen okay?
Yes, Craig, we can. We're able to see your screen.
Brilliant,
Okay,
brilliant.
yes, okay.
It's clear, sir. Clear.
قلت له هو انت عايز تلعب معاهم؟ هو يعني sometimes الاولاد عمر ما هم ربنا.
Don't know who that was, but seemed very excited. Okay, so company summary. So Intelligent Ultrasound was formed in 2004 out of Cardiff University. So we've always been attached to a university medical centre, and even the companies that were amalgamated into Intelligent Ultrasound, which were Inventive Medical as well, they were based on UCL College hospitals in London as well. So we've all got a medical connection, and most of the inventors of our products, especially with Heartworks, are current serving doctors. So Heartworks was made quite a few years ago, probably about 10 years ago, and made by 3 cardiac anesthesiologists based at the Heart Hospital. But we'll come on to a bit more of that a little later. So now Intelligent Ultrasound, we're listed on the stock exchange under the AIMS. We have our main office in Cardiff in the UK, or Wales. We have a main big office in Atlanta as well for direct sales to North America. And about 12 months ago, we opened a support office in Beijing for our Asian resellers and our customers in there. Ultrasound is generally all we do. So hopefully we're very good at it. And that shows in the simulators and the sales we've done to our install base. And also then in 2018, as it says on the slide, we bought another company called Intelligent Ultrasound, hence the name change. And we're now into AI, so artificial intelligence. So we have a clinical side of the business as well. So just to show, we have now, we're about 50 or 60 people within the company, but we have a fantastic network of resellers throughout the world. I think we're up to around 30 resellers covering around 35, 40 countries now. And obviously Simulid, based in the Middle East, is covering our Middle East business, and they're doing a fantastic job for us as well. So some of the things that have happened recently, just to show you how well we're doing with the simulators and the uptake of our educational simulators. Just recently, this month, we reached our 1,000th system, which was sold to Ohio State University in America. So we now have, over 1,000 simulators worldwide, going from North America, Europe, even across to New Zealand. So the simulators seem to be being taken really well. and we adapt to the situation like COVID as well. On our artificial intelligence side, we also last year did an OEM launch of our artificial intelligence software with GE Healthcare on the OBGYN machine, and that went out in October last year. So that's being used to use the AI to probably shorten the scanning time by about a third. So therefore, there's a cost effectiveness issue there, which is great. But more importantly, automatic recognition of structures in a 20-week baby scan. So that's just where our AI is starting. And we'll come on to the AI a bit more later. Also, what we've done with Heartworks, which is more applicable to what we're talking about today, we've been working with the British Society of Echocardiography for probably about 7 years now. And initially, it was just for the TTE examination. So obviously, when a student wants to be TTE accredited in the UK, they come to the British Society of Echocardiography for the exams. They submit their logbook. Generally, I think it's a minimum of 150 studies on patients. They then sit a theory exam, and before that was it. It was peer reviewed with their logbook. So what they wanted to do was actually do hands-on. So when the BSc signed these students off to be clinically competent in TTE, they asked us to use Heartworks. So we did a trial period, and the students would submit their logbook, they would sit their theory exam, and then they would actually go onto a practical station with the Heartworks simulator and do a standard examination, sort of the 28 standard AAC views. Which was really good because it supported their knowledge, and also if they were nervous on their theory side and or any questions from their logbook, this really reinforced their competency. So it works really, really well. So now the BSc are the only ones worldwide at the moment which uses a practical evaluation to sign people off for TTE accreditation. That's starting to be mirrored in a few places. Hong Kong is starting to look at the same. And I think it won't be long before that goes around worldwide. So people actually have good competency and can actually visualize people and sign them off. Also, what we did recently, obviously with COVID, starting this time last year, two things. We made a COVID lung ultrasound package. Sorry, someone want to ask a question? Well, okay. Which we gave to all our customers free of charge because we wanted to help train people in lung ultrasound, which was very, very applicable to helping with the COVID fight. So we did that last year very quickly. And that was starting with a normal, healthy patient with normal lungs, going through a deteriorating patient over probably 3 or 4 cases till it was quite a severe COVID case. So people could actually learn lung ultrasound, because lung ultrasound is still a fairly new area globally as well. But also we use that COVID lung module and the simulator to go into the Nightingale, which was a purpose-built 4,000-bed hospital to fight COVID in London, and train doctors who were actually going to be exposed to these cases in the Nightingale Hospital. So hopefully, I think, we tried to do our best to help the UK doctors and doctors around the world fight this terrible disease. So we're in 2 divisions in intelligent ultrasound. We have a simulation division and a clinical division. Obviously, what we're going to talk about today is our simulation division and mainly our Heartworks simulator as well. So before I want to go on to that, there are some things which are going to lead into Heartworks. So we've actually got an Intelligent Ultrasound Academy. So that's our e-learning site, which goes live in a few weeks. So there will be various courses on there, which you can do from the theory side of life. So there'll be a Transthoracic course for American sonographers. So it's against the American curriculum for cardiac sonographers. But then there'll also be a course for transesophageal echo and transthoracic echo. And we'll continually build on this academy throughout the year. So things like point of care, neonatal, they'll be launched later in the year or next year. So hopefully we're covering the full circle of learning from the theory where anybody can access, especially at the moment with COVID, people can't get to the universities or to the hospitals to learn and train. So at least they can have access to e-learning where they can actually carry on learning and carry on being monitored by their students. And then obviously go on to the practical sessions once they get access back into the hospital. So our e-learning is very exciting, and that goes live in a few weeks. Part of the offshoot with having the clinical division now and using the artificial intelligence, we've got a new product launching this year called Needle Trainer. So that uses our artificial intelligence software on real patients and real echo machine, real ultrasound machines, but not with a real needle. So it's a simulated retracting needle. So we can actually do things like nerve blocks and look at the anatomy under the skin and learn from that as well. So that's really exciting because that's going to be a trainer or a simulator using real live ultrasound, and it color codes the different structures and helps you guide you to where you need to go to and need to be. So that's going to be a really exciting product. Babyworks. So everybody, you know, over the last 7 to 8 years, when I've been doing Heartworks demonstrations, have always asked for a baby. But now we're in the position that, you know, probably Q3, Q4 this year, we're going to launch a baby. So the baby will be in two phases or 2 modules, same as our adults. There'll be a point of care module. So there may be 30 or 40 point of care pathologies or cases that you can run on the baby. It'll be full scanning of the baby, full torso, and obviously also the head as well. And then you'll be able to do the advanced cardiac. So we'll have our Heartworks on the baby as well. Initially, it will just launch this year with a normal neonatal size, so a 1-month-old cardiac heart with no pathology. But then, as we did with Heartworks, we're going to go on to a release plan over the next few years of releasing different pathologies, different congenital diseases, things like the tetraphallos and other pathologies that we can show on baby. So that will obviously, like Heartworks does, which you'll see in a minute, the pathology will be on the 3D heart, which you can explore, you can highlight structures, also see it on the 2D echo model. Then also, either on launch or within a few months after launch, baby will also have 3D echo, because we're going to have 3D echo on the adult Heartworks as well, as you can see here. So this is just a mock-up. This is purely a mock-up because it's still in development. But, you know, again, one of the things apart from baby we've been asked with Heartworks is for 3D echo. You know, 3D echo is becoming more and more useful, especially with cardiac devices taking forefront in the clinical environment. So we're developing this at the moment, and it's going to be an introduction module. So you'll be able to acquire the images on the simulator, both on the software, but also on the mannequin and the probes, and then being able to do all the offline things you would do with a normal 3D data set. So things like cropping the volume and then, you know, understanding that volume. So I think we've been able to foresee the 2D acquisition section of 3D ultrasound, and then using the data, but also, you know, using our fantastic 3D heart for that acquisition and understanding of what you're seeing in a 3D model on 3D echo. I think that's going to be really good. And when we launch, that will be available across all our pathologies. So at the moment, Heartworks has around 30 different pathologies. So 3D will automatically be activated on all those hearts. So that was just a short, short PowerPoint, because I wanted to tell you and introduce us as a company, but also tell you what's happening this year, because, you know, it's very exciting for us that we're going to have new products coming out, especially with baby and 3D, you know, more according to Heartworks. So it's a really exciting time for us, and we wanted to convey that to you. So, does anybody have any questions before I just? Oh, hold on, let me just share my screen again. Okay, 1 second. So I'm just trying to figure out how to stop this screen sharing. It doesn't give me any options. Oh, there we go. Excellent. So hopefully you can all see me again now. So let's go into Heartworks. Cool, cool. So what I'm going to do now, I'm going to switch the view from me because not everybody wants to see me, and go into the Heartworks software. So we can actually go and talk through the software first and demonstrate what some of the things and features you can do within the Heartworks program. So I'm just going to switch to our dual screens of our simulator. So what we've got here, obviously on the screen, are two screens. So we have the fantastic 3D heart on the right-hand screen in the landscape orientation, and then we have the 2D ultrasound image on the left. So at the moment, this system is, it can be on a desktop or a laptop system, but we've got it mounted on a cart. So ergonomically, it feels like a real ultrasound machine. And that screen you're seeing on the left of the ultrasound image is actually a touch screen as well. So what we're trying to do is make it more realistic so it acts and feels like a real ultrasound machine. So all your knobology, I suppose, things like freeze, gain, color, biplane, M mode, all those functionalities, all those buttons are all touchscreen, and so it starts feeling like a real machine. So the screen on the right, if I can just make it, oh, totally. Right, let's go on to this one now. So we're just going to show you the main screens because I want to show you how fantastic this 3D heart is. So the background on here is, you know, I think about 14 years ago, these three doctors that I spoke about earlier in London, they were teaching their cardiac anesthesiology fellows cardiac ultrasound in theatre. And it was actually quite surprising on the lack of knowledge of the cardiac structures that these fellows were showing. So they thought, you know, we need to get some training for them. And they looked on the internet, on the various websites to try and find something apart from a book that they could teach their students the cardiac structures from. You know, the heart's got about 130 different cardiac structures, obviously some smaller and moving and bigger than others, and there was nothing on there. So they thought they'd make their own 3D hearts. So over time, and with a company called Glassworks, they used real MRI, real CT data, real echo images, and actually took our developers into open heart surgery to see what a wet, beating heart really looks like. You know, not a computer program or photos or a video, but in real time. So that, you know, we came out with this heart. This is generation 2. The generation 1, which came out originally, was about 90% accurate to a normal human heart. This is now about 95% accurate to a normal human heart. And the reasons why we went from generation 1 to 2 was because when we took a volumetric scan of a cadaver heart, which was the initial basis for the 3D model, obviously things like the pulmonary veins and pulmonary arteries were slack because obviously there was no blood flow. So obviously when we took the volume, it was slightly out. So we spent a bit of work doing that to get it right. I don't think it'll ever be 100% because we're still learning things about the heart and some of the relations and some of the things it does. But for teaching purposes and the things that this can do, you know, the features and benefits it can offer are fantastic. And yeah, we've proven that with various studies around the world. So the studies come out from Duke, Harvard, UCLA, King's College in London, all around the world showing the effectiveness of learning with this 3D heart. So some of the things we can do, obviously we can, because it's in a 3D environment, just with a mouse and keyboard, we can orientate it in any way in the 3D environment. So we can see every aspect of the heart. We can zoom in, zoom out, we can move it around. So it's great to start understanding what the heart looks like, what it feels like. You know, we all do the cadaver workshops, but they're a dead heart, they're a non-moving heart. Here we can actually see what that heart is beating like. And putting this on a big projector in a classroom, you know, you get people's attention straight away. They are focused on learning. They're actually enjoying what they're doing. So the learning becomes very much a second thing. They're actually just enjoying taking part in the learning. But some of the things we can actually do on here is we can actually use our structure marker here, and we can actually move our cursor onto any of the 130 structures. First thing we can do is we get a pop-up telling you what that structure is. So just by moving your mouse around, it tells you what that structure is, which is fantastic as a quick look. But what you can also do is you can left click, and then if I go back and start the heart again, it stays highlighted. So you see the heart has slightly died away in color, but that ascending aorta is now stayed highlighted. And what we can do is if I bring in the intercardiac structures book and scroll down, what's happened is this intercardiac structures is basically a textbook built into the system. And because I've highlighted it on the heart, it automatically highlights the correct page in the textbook. So there's no more me going to find the right book, find the right section, try and find what I actually want to learn about. This will do it all for you. Now, obviously that's telling me it's the ascending aorta, but it's also giving me 2 hyperlinks at the end. So the first one is a default view, so I can click on that, and the computer will rotate the heart to what it thinks is the best view for me to see that structure at. And that comes really useful when we start looking at internal structures in a minute, things like the mitral valve leaflets. But then also there's a little booklet which says Open Anatomy Notes. And again, it's bringing more resources very easily and quickly for the student to learn from. So obviously it tells me here, and it depends on the structure we're looking at. Obviously some structures have got more information than others. And later when we come on to pathology, because this is the normal heart, then when we come on to pathology, they'll start talking about mechanisms of the pathology, you know, why we're seeing it, you know, what are we looking for, what measurements should we do, what calculations should we be doing. But now if I just get rid of that, so obviously here we've looked at the ascending aorta. I'll read about that information, about that structure. But then below, obviously it's got TE imaging plane. So now it's telling me if I want to see the structure in an ultrasound image, then I will be looking for a mid-esophageal ascending aortic short axis view. So now if I bring both screens back, these are also shortcuts. So if I click on that, what you'll see is a probe manipulating itself on the heart model and taking me to that view. And obviously on the 2D ultrasound on the left-hand side, you'll see that image on there. So we can obviously see the pulmonary valve, pulmonary arteries, left and right. We can see it sliced away on the 3D heart, so we can then understand what we're seeing on the ultrasound image as well. And again, even though we've let the computer do that for us, we can still go back to our anatomy selection structures and select structures. And what we'll see now is I've selected, let me hover on it, the pulmonary valve, and I go back to starting the heart. What happens now is because that structure is in the ultrasound beam view, we'll see it on the echo image as well. So now we'll see it in red. So again, I can go there. Now, instead of going to the 3D heart model and highlight from there, I can also go to the 2D ultrasound image and highlight there. And because they're all correlated, so whatever I do on the 2D echo, the 3D heart model, or even by the textbook, they're all linked. So it happens across the board on all three features. So now we'll see the aorta, and I'll see it on here as well. So again, I can just make it start again, and it's highlighted there. I found this really useful when teaching a group in America a few years ago. When I'd highlight a structure, I'd then give them the TE probe on the mannequin, and then they could actually go and find the structure I've asked them to find. So that's therefore testing and evaluating their cardiac structure knowledge and their structures relationships. And what happens then is as they start moving the probe, obviously because they're fairly new, when they start seeing a slight bit of red on the ultrasound image, they know that they're starting to get into the right view or seeing that structure. So then they can slightly reduce their movement speed and start focusing on that structure and getting a better image. And that works really, really well. Now, the good thing with Heartworks is we've got a little home button here. Let me just go back to the main screen. And if I click that, it's basically your get out of jail free card. So it puts the system back into the default view with the probe out of the way and the 3D heart full again. So if you've been playing with the heart, you've turned it inside out, upside down, you can always go back to the home with a click of a button and it gets you back into this orientation. Now going back to that textbook. So if I've got a student, they've been in a lecture, for example, and we're talking about the mitral valve in the lecture, but they don't know where it is, or they don't know how to open up the heart on the Heartworks to do some more learning, then you can go to the textbook and do it the reverse way. If I go to the mitral valve, posterior leaflet, what were they talking about? Okay, they were talking about the P2 scallop. So I could find information on there by opening up the anatomy notes. But what I want to do now is look at the default view. So if I select this default view, what happens is it shows me the surgeon's view of the heart. So it takes the top section of the heart away and shows me this fantastic beating 3D view of the heart. Obviously, it's highlighted the P2 scallop there of the mitral valve. And what I can also do as well, down here, underneath the heart, we've got an ECG and a breathing rate. And I can actually start slowing that down or pause it. So I can slow it down. So now people can start understanding the double opening and closing of the mitral valve and see the chordae actually doing their job, opening and closing the valve. Even when I come to pause, I can scrub the ECG, and then students can actually start learning from an anatomy point of view what happens with each part of the ECG wave. So what happens on the R wave, S part of the wave, etc., etc. So they can start learning the electric activity and how that affects the opening and closing, systolic and diastolic opening of the valves. I could also go in a bit more. I remember the film Inner Space, which was on in the 80s. I'm getting that old. But here I can actually see the inside of the heart, the ventricle wall on there, all those fantastic parts that we can learn from. And again, at any time, we can go back and we can highlight different structures. So if I press play again, or actually if I scroll through to where the gate code adaptation of the mitral valve, I can scroll through and see A2, A1, A3, all the posterior scallops, even the anterolateral commissural leaflets there, and there should be one here as well. So again, it's a fantastic way of learning, and we've seen that over the last 10 years, I've seen students learn off the 3D heart, learn the cardiac anatomy, and then instead of just moving their probe around, if they're in the mitral valve view, they want to get to the aortic valve, they know inside their head already from learning on the 3D heart model here that, okay, the aortic valve just sits above the mitral valve. I just need to bring the probe, withdraw the probe out slightly, and I'm going to start getting aortic valve. So again, it saves a lot less movements, more refined movements, and a quicker and better way of examining the cardiac patient. Let me go back to here. So that's the heart model. So the heart model, just from an anatomy point of view, is fantastic. You can put that on a big screen, on a projector, and teach a class. It lends itself to so many different areas in different parts of the hospital or university. We've also launched, I think, Simile did a webinar recently on our Heartworks augmented reality tablet. So we've got part of this software onto a tablet, which is good for, obviously, especially COVID times now, so people can take them away and learn at home, or when they're not on the simulator, they could learn on the tablets very cheaply and very easily. So they still have the anatomy tools, and then the cardiac imaging as well. So coming on to the cardiac anatomy. So obviously with this system, you've got TEE and TTE, but at the moment, let's just stick with the TEE, and we can actually use the virtual probe in two ways. One way, which we'll come on to later, is we can just attach the simulated probe onto the mannequin, which I'll show you in a while. But we can also use it virtually. So as you can see on here, in the top right-hand corner, we have some virtual probe controls, which are controlled via mouse and keyboard. So we can advance the probe. We can also twist the probe left and right, or turn, depending on the terminology. You've got the anti-flexion and retroflexion. And then you've got the lateral flexion, the left and right as well. And then the multiplane as well. So obviously increasing your plane rotation from 0 to 180 and back again. Now what we've done to make it even easier to learn on this is we can put it into slice mode. So what happens now is the heart will slice according to the ultrasound beam. So as I advance the probe, you can start understanding what you're slicing through and why you're seeing it on the 2D ultrasound screen image. Obviously, when the students are learning without this aid, they're on a real patient, so there's obviously all that side of life being rushed and having a limited time frame. But also, you're not being able to see the tip of the TE probe because it's inside the patient. Obviously, all the safety factors with that. So this way, they can actually see their probe manipulations. They can see the probe adjacent to the outside of the heart and understand from a 3D environment what they're seeing in a 2D environment. Because on a real patient, all they're seeing is a 2D image where they're trying to generate a 3D image inside their head. And it's been proven that some people can't do that. Some people can't get that 3D visualization in their mind. It's a bit like, you know, some people can't see 3D television. So this way, it helps them. We've done the work for them. And even when they start learning the probe manipulation controls, most people eventually get the probe advancement, the withdrawal. They even get the retroflexion and the antiflexion because obviously it's a probe tip movement. But when you start talking about things like the multiplane and you're trying to explain to them that the probe tip's not moving, but the crystals are rotating the ultrasound beam. But now if I was just trying to do that without the help of this heart, I could be there 15, 20 minutes, maybe longer with some students. It depends on the level of student. But for them, just to see the apex of the heart, the probe tip, and then me actually rotating that ultrasound image, it's fantastic. It's the old saying, a picture paints 1,000 words. They instantly get it and they understand the reasons why, and it makes their learning curve a lot more easier and a lot quicker for them to learn. And then they can focus on other aspects like advanced pathologies and calculations, measurements, etc. So obviously you can do that on the mannequin as well. So if I just switch back to the profile, so now what I can do is actually I can make the probe active. And what we have here is a simulated TOE probe or TE probe. Now the good thing with our probes, obviously on a real probe, this part of the probe has got lots of flexion wires. So you've got to be really delicate with it because they break really easily. And obviously with that breakage is a cost for repair or replacement. This is a simulated probe that has no wires inside. So, you know, even though we teach students to treat it as a real probe, so they get practice on a probe when they go to a real probe, they can't really break it. Obviously, there's all slamming the sensors which will break, but you know, when you do this on a real probe, you've probably broken the flexion wires by now. But here you can't. So with simulation, you know, in my mind, simulation's got to be a couple of things. Firstly, it's got to be safe. That's why we're learning on a mannequin and not real people. But also, it's got to be cost effective and available 24/7. So this simulator is very high end. It uses a magnetic sensor array, so it detects the probe position and the manipulations instantly, and you'll see that on the software in a second. But acts like a real probe as well. So the speaker on. So you can advance the probe as you would do. And now if I switch to my screens, now you can see, let me just move that out of the way slightly. So as I advance my probe, and this is me doing it with a simulated probe, it acts exactly like a real probe will on a real patient, but more safely, more, you know, no way of damaging the probe. So you've obviously got your flexion, your lateral, exactly all the same movements as you would have on a real probe. You see, I'm just moving it back and forth on here. So with this mannequin, you've obviously got transesophageal. You've also got transthoracic, which I'll come on to in a minute as well. So you've got full body scanning on here as well. Just go back to the screen. Some of the other things we can do with the heart, obviously with pathology and things like that, you know, being able to eyeball the pathology or a normal heart on the echo image. So what we can do here is we have the standard imaging planes, which are obviously the AAC 28 standard imaging planes built into the system. So I could go here, I could find the mid-esophageal 4-chamber view, and the system would take me to that. So what we're seeing here is the probe manipulating to the back of the left atrium, slicing through the heart down to the apex, and then seeing it in the ultrasound model as well. So that's a good 4-chamber. Now, the good thing is with these slides, these pre-done slides, when you go from slide A to slide B, it doesn't just take you from a 4-chamber to maybe a bicable view. What will happen is it'll actually go from A to B, but it will manipulate the probe on screen to demonstrate and show you the movements you need to do to get from A to B. So if you just watch now, if I go to a bicable view, you see there the heart, the probe position moved slightly, it rotated the beam and got us to this position here. So again, this is our high, my background is I was a combat medic in the army. I've been in simulation for about 15 years. So cardiac ultrasound was very new to me. So I actually got this out on my kitchen table years ago, and I learned from the system. So being able to see the probe manipulations on screen, moving from A to B and how to get from A to B was phenomenal. And it's basically it's a self-teaching system. So it's phenomenal. So I can then go back to here. I can then go to a long axis view. And again, even though the computer's taking over, I've still got control. I can still manipulate. I can still zoom in. I can still highlight structures. So from a teaching point of view, it's an amazing interaction. It's an amazing experience. And again, on TTE, we've got exactly the same. Just orientate itself. But what we've got here instead, because obviously with Transthoracic, we can't have on-screen controls for Transthoracic. We can only have the simulated probe on the mannequin. But what we do have instead of the controls is what I call a red dot map. So basically, the red dot is the tip of the TTE probe, and it shows the student whether they're on a rib, so obviously they're not going to get an image, or whether they're in a rib space and where their position is against the patient's chest wall. And obviously, you can see the rib and the rib cage on the screen there until you zoom in closer, and then it fades away. And again, if I rotate round, you can see the liver, you can see the big vessels here as well, and the spine. So again, but what we've done obviously on the Transthoracic, because there are so many different ways to list the Transthoracic views, there's different courses, there's FAST, there's EFAST, there's the blue protocol, et cetera, et cetera. So we've just put them in a logical order. So parasternal views go through to apical views to subcostal views. So some of the functionality, have I got a second screen? No, okay. So going on to some of the functionality we've got on the ultrasound. So now we're going to come on to the ultrasound section on the left screen. Obviously we've got 2D, we've got the heart rate, we've got the breathing rate, which we can slow down again. We've got gain controls, so we can change the gain as we do on a normal ultrasound. The TGC controls work exactly the same, either with a mouse or touchscreen. M mode. So again, you've got M mode functionality on there, which I could freeze if I wanted to. And I could also do my caliper measurements, which comes in the top left-hand corners in centimeters. I've also got biplane imagery. So this is really what we had to do towards the cardiac devices, but also to lead into our 3D echo later on this year when we release it. And again, we can change the angle on there, we can change the orientation on there. But what you'll also see when we do that is you'll now see the 2 image planes on the 3D heart. So again, it really helps you understand your image acquisition when you're talking about biplane. And what you're seeing by the 3D model on the 2D ultrasound. So that's really, really useful. Then obviously Doppler. So what we actually did is we did a few years ago, we spent a full 12 months developing a full Doppler model, so a full flow data set within all our hearts. So all our hearts, our normal, our pathologies, all 30 have a full data Doppler flow set, which is all parts of the heart, not just the valves. You know, you could put the window, the acquisition points anywhere in the heart, and you'd get a reading like you would do on a normal heart. So, you know, if you're measuring mitral regurgitation or an aortic stenosis, you're going to get the same sort of values as you'd expect in a patient. There might be a slight variation, because obviously this is a simulated heart, but you'll get, you know, the effect that, you know, aortic stenosis, you're going to get a peak rate, you know, really high rate on CW. So again, you can move your color Doppler sampling gate there. I can also change the size. One good thing I've noticed with Heartworks is because Heartworks, the computer and the graphics processor is so powerful that normally on a real machine, when you make that window bigger on a Doppler, the frame rate starts to drop. But Heartworks is pretty powerful. So just one caveat is the frame rate won't drop depending on the size of that window. Also, you've got the scaling on the right-hand side here. So again, you can change that scaling and get analyzing on there as well. You've also, that's obviously your color flow on there. You can then introduce pulse wave Doppler, and you've got your sorry. Hello? No? Any question? Okay. So yeah, so I can move my sample gate with a co-adaption of the mitral valves, for example. I start getting my waveform here. And again, I can then freeze that waveform. I can do my velocity measurements, which you'll see there in centimeters per second, and my gradient in milligrams of mercury. I can also do my VTI measurements. So I can trace my waveform, get my mean gradient of my VTI, and even pressure half time. So they're just some of the quick reference measurements. But also on here, we've actually got a full measurements pack. So now if I go to the measurements, you'll see here, we've got around 70 different measurements and automatic calculations. And the good thing is let me just get rid of the Doppler. If I go, for example, to the left atrium, and we go to maybe Simpson's rule. So now at the bottom of there, it tells the student how to do the measurement. So, you know, scroll clip to the end of the systole, so end of the T wave. So P, Q, R, S, T, if I'm correct. Position your cursor on the mitral annulus, so I'm going to start there, and then click and trace, that's my fault there, around the border of the ventricle on the 2D image. So I'll do that, and then I'll left click to join the measurements up. And again, obviously Simpsons is the coins to work out the volumetrics, as you all guys know. And it give me that Simpsons measurement in millimeters for the volume there as well. So on all those measurements and calculations, you can actually, it tells you how to do it. And then this will basically go into an echo report. So here we've got echo report, so you can actually put the age, the date. So exactly, fairly generic, but similar to what you do on a normal patient in the echo lab. So again, those calculations would automatically fill this echo report, and then you can save it on the system or save it as a PDF and export it via USB, for example. So you can actually test your students using this way, give them a pathology, ask them to go and do a full echo report, and then give them feedback from that report as well. So it's a phenomenal way, and it's probably because of the accuracy, the way we built the 3D heart, you're going to get, again, those measurements as you would do with a real patient. There's lots of people out there who've been trying to do this, but it all goes down to the accuracy of the heart. If you haven't got the accurate data set to build this 3D heart, then your measurements are going to be all over the shop. They're going to be incorrect, not what you'd expect on a real patient. And also probably only on a normal heart and maybe 1 or 2 pathologies, where all these calculations are available on all our hearts, on all our pathologies. We made sure, you know, you want to be able to see the pathology on the 3D, on the 2D, but then quantify it by using the calculations and measurements. Press play again. So again, one thing we didn't do there, obviously if you want to look at the aortic valve, you've got the continuous wave Doppler as well, and you can change the scale. You can move the baseline up and down as you would do with a real ultrasound machine. You can change the sector width. So all the things you'd expect on your real machine's depth are all there as well. So, you know, that's an overview of the heart. I just want to quickly show you why I've got you all. Maybe 1 or 2 pathologies. So let's do a mitral regurgitation. So what happens here is when you load a new pathology, because the data set is so big, so much data with the structures and also the Doppler, it has to reload a new data set for that pathology. So just take a few seconds to reload. But why that's loading, if I just go back to the mannequin. So this mannequin, this is our new Bodyworks Eve mannequin, based on a female, and there's a reason for that. On this platform, Bodyworks Eve, obviously we've got Heartworks, so you've got Transthoracic and Transthoracic, and you can have them as a dual system, so both, or just TE or TT on its own, because she's very modular. Also, we've got on the same mannequin a POCUS, a point of care module. So that has 116 different pathologies, full torso scanning using real ultrasound. So what you'll see when you scan on here is real ultrasound. And because those cases you can combine, so you can combine a cardiac with a lung, with abdominal, that gives you over 10,000 different patient variations. So, you know, you can have them separately, or what we'll find with most of our customers now, because, you know, when they learn they want a simulator that can be used by cardiology, cardiac anesthesia, ITU, maybe paramedics even, you know, depending on the level of training at the hospital, is they'll buy the whole system. So with this Bodyworks Eve platform, they'll buy the point of care module, and they'll also buy the Heartworks for the advanced cardiac imaging. So, you know, it's a very good cost-effective way of training, because you've got one platform that can do multi-modular training, either a basic point of care or advanced cardiac. Let me just go back here. So now what we've done here is we've loaded a mitral regurgitation model. So quickly I can go here, go to a 4-chamber view. Now here, obviously what's happened on this, you can see on the model, let me zoom in slightly, is we have a P2 prolapse. So you've got the prolapse there, and what I can do is I pause that. I can then highlight this P2 scallop as I did before. Press play again. And now obviously what's seeing, because we're in a 4-chamber view, which is a good way of seeing some of the scallops and the mitral valve, we'll see that prolapse on the 2D ultrasound image on the left-hand side, which is obviously the old hockey stick effect. So that's great. So first off, we've identified the structure, the pathology of the structure, and hopefully understanding why we're seeing that. And obviously if I rotate this, if I go now to my intercardiac structures, go to my surgeon's view, and I can then slow this down. Now I can see why, in a second, why we're going to get the Doppler we're going to get, because when the coadaptation occurs, when the mitral valve comes together, because of the prolapse, obviously it causes the slight hole, the slight gap between the two, the posterior and the anterior leaflets. Now, if I look on the ultrasound image on the left, now if I add color on there, obviously you can see the regurgitation jet that's coming out of the mitral valve. And what I can do is I pause that heart and then find the jets, Obviously, then I can do my measurements for the gap as well. So again, there's quite a lot of things you can do with the pathology on the back. Play. So that's one of the pathologies. If I go to some of the advanced pathology, so we have on here let's go a TAVI. So recently we've developed with Medtronic the TAVI device and deployed that, I think in about 4 or 5 different types of cases. So we have a normal TAVI implant, we have a low implant, a high implant, a constrained device, and then I think 80% deployed. So again, great for training. A lot of hospitals are doing TAVI procedure. We've also got things like the Watchman device in here as well. And actually, Boston Scientific, who developed the Watchman, they approached for us to develop the Watchman device in our 3D heart for 2 reasons. Firstly, was obviously to train their clinicians and use of the Watchman device and the different types of appendage it can be deployed in. But also, they used it when they went for their FDA approval to show how they're going to train their customers, but also how the valve looks in an ultrasound image under TTE. So it was phenomenal to be able to be part of that and use our technology to help them get their FDA approval. So again, now I could just use my probe. Well, mouse. So I could either do that, or I could just go to a, let's see, I'll tell you what, I'll just do it with let's slice and dice that. Move that around, zoom that in, go to my angle. Let me go this way. A bit of a pig there of this. Let me just go back. Right, that's better. So again, we can start seeing a valve in there as well. If I can zoom in on the heart model as well. So there you go. So it's now seeing, I'll change the depth on the ultrasound image, wrong way. So again, we can start seeing the valve in the 3D heart on there, and we can position that and see how we'd improve the image on there. And obviously, we see that co-adaptation, the 3 leaflets of the TAVI device on there as well. So, you know, some of the pathologies we have, I'll just quickly go through them so I don't keep you time too much. We obviously have the normal heart, anterior wall abnormality, global dysfunction, hypovolemia, mitral regurgitation, mitral stenosis, aortic stenosis, aortic dissection, and ASD. Then we have different types of Watchman device, so in different types of LAA, mechanical AV replacement, right ventricle dysfunction with a tricuspid regurg, different types of LAA without the device, normal heart and lungs. Obviously, this has got lungs in addition as well. Pleural effusion, so we have got some lung imagery on there as well. Cardiac tamponade, aortic regurgitation, pneumothorax, PE, right coronary artery regional wall abnormality, HOCM, then the TAVIs as well. So there's quite a lot of pathologies to learn from on the simulator, and therefore, you know, there's a great deal on there. And what you can also do as well is there's a presentation tool, so it's like PowerPoint built into the system for you to deliver pre-made slides, so you can have it done to make your life easier when you're teaching. And also, if you've got a USB stick, you can actually take screenshots of all this for your own PowerPoints or your student resources, your student handouts for etc. for them to take away with them as well. So I mean, that's quickly an overview of the simulator. of the Heartworks. Obviously, you can also do the point of care, which I mentioned earlier on here as well. So hopefully I've given you some insight into our simulator. I welcome any questions. Any questions at all? Natalie?
Yes.
Okay, well, I don't think anybody's got any questions.
Seems all is good.
That's good.
Any questions?
No, okay. If you want to
Hello, Greg.
Oh, sorry. Hello.
Hello, Greg. I
Hi.
would like to ask you, will be a lung scan available in the future?
Live scan.
Lung scan.
So yes, so with our we have some lung imaging on Heartworks. Oh, sorry, 1 second. Our fire alarm's going off. Hopefully it's a test. Oh, I think I have to go. Quickly answer your question before I go. There are lung imaging on Heartworks. There's about 4 or 5 cases. But our point of care, oh, there we go, it stopped. Sorry, our point of care module has a lot of lung ultrasound already, and also COVID cases for lung as well. So we mainly focus our lungs in the point of care because it uses real ultrasound cases. So it's actually more realistic and looks like a real ultrasound imaging that you're going to get on a patient. I hope that's answered the question. Any other questions? I said that presentation will be around on the Simulator website, so you can always go back to it. Also, our Intelligent Ultrasound YouTube channel has all our products. We obviously have OBGYN products and some new products coming later in the year will be on there as well. So check out our website and our YouTube channel because there are short videos on all of this functionality that you can just sit there, watch a quick 1 or 2 minute video, and it tells you all the functionality. So the YouTube channel is really, really useful.
Okay. Any more questions? Okay, well, I believe we're good. No more questions. Thank you for the amazing presentation, the demonstration. Thank you, Craig. Thank you, attendees, for joining. Thank you for your time and attention. I think we're good to you.
Sure. Thank you, Natalie and Charbel, for organizing. Thank you.
Thank you for your effort.
Thank you, guys. Thank you.
Okay.
Thank you so much. Have a great day. Stay safe.
And you. Goodbye.